Representative Kelley.
Thank you, Madam Chair and Commissioner Reese, for being here. You're much more of a healthcare expert than me, so I'm going to maybe ask a couple questions that people here seem to think are elementary. But critical access hospitals and Trauma One hospitals are extremely special hospitals in our network of providers across the state. Is that correct?
Absolutely.
Would you know, kind of off the top of your head, how many critical access and Trauma One hospitals we have in the state?
I do not. I want to say something about 68 critical access, but that number could be incorrect. And trauma level 1, I'm sure the number is less than 10, but we could find out for you.
So 10 at the maximum. So 78 hospitals out of how many hospitals in the entire state?
158 or 59, something like that.
And I understand when you came up with the RFP that it was designed to save state taxpayer dollars and to keep premiums low for the beneficiaries as well. But really, regardless of how low the premiums are or how wisely their taxpayer dollars are being used with the contract with Blue Cross Blue Shield, the teachers and state employees in my community feel like they're getting a raw deal here because they cannot go to their local hospital. And I think that's a shame that we're allowing that to continue as a state. And so what I want to know is what changes are you considering to the RFP to make sure that this doesn't continue? And have y'all considered specifically to make sure that before Blue Cross or any other insurance company can bid for the state health benefit plan contract, that they have provider networks in place with at least these two special forms of hospitals?
Well, they do include trauma and critical access hospitals all across the state.
But not all of them.
Not all of them.
Because my administrator was just here, and he's a critical access hospital administrator, and my parents are teachers. They can't go to our local hospital. My grandmother's a retired state employee, and they're just representative of thousands of people I got in my district who are suffering. So I want to know what we can do to fix that moving forward.
We have not made a decision on any kind of procurement for 2016. As I said, we learned from 2014, and we will do the same for this year. So it's instructive for me to hear your concerns, and we're going to do this study to look at the cost of the plan relative to other insurance products. And I'm sure these will all be things that we'll consider.